In the spine and pelvis, from the hips up to the base of the skull, there's over 75 joints that help the body do what we do with it every day. And as long as all those parts are sitting and moving properly, we can go do those things. There'll be no conflict and we should feel pretty good. In fact, that movement and activity should be good for those over 75 joints. But sometimes, because we've lived life and done things, and some things have happened, either things like macro trauma or even some repetitive micro trauma, some of those over 75 joints may not be sitting and moving properly. So if we thought about that for a moment, and we go to do something, but one of those joints isn't sitting and moving right, but we're trying to use it to do that thing that requires that movement, that conflict is what can create some discomfort or problems over time. And if left there sitting and moving wrong, that problem typically deteriorates or degenerates and gets worse over time. So chiropractors quite often assess those over 75 joints for their function, to see how well they're sitting, are they in alignment, and as well to check and see how well they're moving to make sure those joints have good function. Because if the alignment and function are good, you're going to feel better. And if they're not good, but we can find a way to unlock them, release them, and retrain them, you're going to feel better. All right, so structure and function at the chiropractic office can get you out of back pain, neck pain, and also help prevent some of that back or neck pain. That's your back and neck pain tip for the day from Dr. Dave at the Toronto Neck and Back Pain Clinic.